Examination of the hip joint also needs to be done, especially in the neonatal period, because we are trying to look for any dislocation of the hip joint or developmental dysplasia of the hip joint. And to do the examination of the hip joint, you can use two maneuvers, that is Otoloni's test and Barlow's test, which basically help you in knowing whether the hip joint is either dislocated or not, or dislocatable or not. So one can make that out and plan out an appropriate intervention for that. Neurological examination of the baby is another important area of examination which needs to be paid attention to. Very often in a newborn baby, neurological examination is bypassed because it is not very easy to do it. But broadly, one needs to look at neurological system of the baby because there could be serious problems with the neurological system. So what would give us information about the neurological examination of the baby? The posture of the baby. If there is any abnormal posture, it may be because of a paralytic problem or some other problem. So any abnormal posturing, muscle tone, look at the muscle tone of the baby by moving various limbs of the baby. See the response to stimulation. What is the response to the stimulation? Whether the baby is able to, whether the baby is crying on stimulation and then becomes quiet also, whether he has activity on stimulation or not. Quieting is there or not once we are stimulated. What kind of movements are happening when you are stimulating the baby? And also one looks at neonatal reflexes to get information about the intactness of the central nervous system. A detailed neurological examination, as we would do in an older child, may be required in certain newborns who indicate from this examination there is any underlying pathology. So you may need to look at what is the power of the individual muscle groups or what are the deep tendon reflexes. So one may need to do a complete neurological examination as you would do in any other older age group.